Now, this is the HIV tridot, which is rapidly done in most of the hospitals. This rapid test which is being done, tridot stuff. And I have seen up thrice and four times only that both dots, HIV1, HIV2, have come positive. And so it's common in India. Not so common actually. HIV1 is obviously common, and you can remember group M type C, that is there, which is a subfamily, lentivirini. Okay, and it is a retrovirus that you know, and it is having an enzyme that is termed as what, reverse transcriptase. Okay, so that is also needs to focus upon. Regarding the Western blot, this is the most specific test. Okay, this is the most specific test, used to be in fact. And now if the option HIV RNA PCR is there in front of it, then you have to mark up that as an answer. Okay, so Western blot is being superseded by what, HIV RNA PCR. Now down you can see up the this let me come later regarding them. You see here that is hepatitis 1 spherical tubular Dane, which is the most common, guys. Spherical. Okay, Dane particle is 42 nanometers, the full particle. Okay, and these are having the various genes, that is P gene, C gene, S gene, X gene codes for carcinoma and all. P gene is the largest gene. Okay, so that all you need to focus upon. Regarding the hepatitis B vaccine, also you need to focus 016, and how much should be the titers, more than 10 m international units per ml. That should be the titer after the 6 months when you go for it. Fine. And besides that, in the hepatitis B virus, the question which have come in your FMG exam was chronic hepatitis B is being diagnosed by more than more than 6 months. If HBsAg remains positive, there is chronic hepatitis B. Besides that, which other antibody will be seen up there? IgG. HBE suggests what? Active replication. Okay. Acute hepatitis B is best diagnosed by HBsAg along with the IgM anti-HBC. Okay. IgM HBC means the core antibody, and the core antigen never comes. The antibody directly comes, and this combination is the best to diagnose of the acute hepatitis B. Chronic hepatitis B, more than 6 months, HBsAg positivity. If anti-HBs is founding, then that is vaccination. Okay, and this is the structure of the HBV, and these pre-S1, pre-S2, they code for this particular HBsAg domain. This is a polymerase. This is one important thing, that hepatitis B is a DNA virus. That also needs to focus upon. Fine. Now, as you can see here, that this particular one is the Ebola, which is not typical of Ebola. Okay, and definitely can come in the exam. Which particular Ebola virus is the most dangerous? That is the Zaire Ebola, which is the most dangerous one. Okay, and other ones are also there: Sudan Ebola, Ivory Coast, and all. Least effective is like Ivory Coast, least virulent, I should say. And how does it spread, guys? It spreads by the contact with the patient, secretions, or like by the sexual transmission also. Okay, and Ebola is famous, and the same way the Zika is also famous. And Zika was being asked in the Kaun Banega Karorpati also. How does it spread? By the Aedes and the sexual transmission. And if it happens to the pregnant females, they tend to develop that child, the newborn, tends to develop what? Microcephaly, and along with that the GBS. And what is GBS? Guillain-Barré syndrome. And do you heard this GBS with something else also? Yes, with the Campylobacter jejuni, this particular thing was there. That is the GBS, and strong association is there with Campylobacter jejuni. Okay, guys. So this is there, and this is polio one, which definitely not be asked now. Like in India, it's not there, but our favorite Pakistan, Afghanistan, Nigeria, they are having it, the polio stuff. And the most common is the wild type. It is the most common wild type is, that is type 1 polio. Type 2 is the most antigenic one, and type 3 associated is vaccine associated paralysis, that is the VAP. Okay, which cells are damaged? Horn cells are damaged off, and this is nasal body degeneration in this particular one. Okay, so that you already know. And the polio virus belongs to which particular family? That is it is Picornaviridae member. Okay, and in the Picornaviridae itself, when I remember here that one particular important member is this, that is the Coxsackie virus. Okay, Coxsackie virus A and B. Coxsackie virus A leads to acute hemorrhagic conjunctivitis. Remember this, this is coming. Coxsackie virus A24 and antivirus 70 leads to acute hemorrhagic conjunctivitis. And the Coxsackie virus B, that particular one leads to epidemic pleurodynia, that is Bornholm's disease. That is important. Okay, and both A and B, they can do what? HFMD. And what is HFMD? Hand foot mouth disease. Okay, what is that? Hand, foot, mouth disease. So this is very clear that these particular things, like you can remember from the virology, a lot of questions they can come in and around them for sure. Okay, besides that, guys, what can else be asked here? So what else can be asked is regarding the Rota. They can ask you regarding the rotavirus. Rotavirus is a double-stranded RNA virus. Okay, remember regarding the Rota, it is a double-stranded RNA virus. Okay, belonging to the Rheovidae. Fine, and it is having a segmented genome. It is having a segmented genome and wheel with spoke, that is in the electron microscopy. And this can be asked that which one is responsible for the secretory diarrhea. The NSP4 is responsible for the secretory diarrhea stuff. Okay, so this is to be observed up in the virology. In 25 minutes I've told you, like if you do up, 5 questions are coming from it. Okay, besides that, if somebody asks you, like I'm just like telling up that which all can be there in the exam. Okay, so HFMD might be a question. They can show you a picture of HFMD. Fine, and besides that, in this particular one, HPV is a favorite, hot favorite. They can ask you the human papillomavirus. They can show you the picture also. And besides that, guys, that BK and JC, that progressive multifocal leukoencephalopathy and all that is being done by those fellows. And that BK is borrowed kidney in the kidney transplant patients. That is the BK cells. Okay, decoy cells. That was a FMG question. Decoy cells. They look like a malignant cells. They are seen in this BK nephropathy. So that also needs to focus upon. And regarding the most favorite, that is in the virology, that is your coronavirus. And coronavirus is that it is a single stranded RNA virus. Most of the RNA virus single stranded, enveloped or not, it is an enveloped one. Okay, it is an enveloped one. Positive sense. Okay, this particular one is a positive sense virus. And obviously, the structure is having the spike protein, all those stuffs. And in fact, it is having a largest genome as per the RNA viruses. This also is there. And solar corona like appearance, that's why the name have come, this corona and all. And there was in 2002 the first episode, and the second time 2012, and now it have come with a bang, that is causing of what? COVID-19. Okay, termed as the pandemic of the second pandemic of the recent times. Like before that, the swine flu was considered as a pandemic, 2009, and this is COVID-19, started from China. Okay, and as per the the Delta variant, which was prevalent in India, that is also important stuff regarding this particular one. Okay, and if somebody asks you what is the investigation of choice here, the investigation of choice is obviously RT-PCR. That is there. Okay, and obviously you can culture it, and culture it in which biosafety levels? BSL-3. You can culture it, and these RT-PCR testing, they can be done which levels? BSL-2. Okay, that is biosafety level 2. So this is there. And for Ebola, you can remember up this particular thing also, that BSL-4 is used for this particular one only. And investigation of choice for this is also what? That is the RT-PCR. Okay, and they can their hot favorite is Zika also, and they move in and around that. And in the NEPA, you can remember up regarding the bat stuff. Okay, the bat, they can show you the bat, they can give you a picture of that. So this is there, that is there. So you can focus upon that particular thing also. Okay, so now in the important one, which I feel that they are coming in the exam, I will focus upon that, because virology I have not covered before. So that's why, otherwise my parasitology video is also there on my YouTube channel, and my bacteriology video is also there. Bacteriology, hardly in the 25 minutes I've told you. In the 30 minutes I've told you the parasitology. Okay, this is in the 30 minutes, and this I will also tell in 10 to 15 minutes. Okay, so this particular thing covers up your whole microbiology within 2 hours. Okay, if you just see up this particular thing also, you will able to answer most of the questions. Okay guys, I will tell you very important, ultra important thing in the mycology. This is ultra important thing, that is the favus is caused by Sean Lenny. This question is coming. Okay, another question which is coming is Chirion, and Chirion is by mantigrophytes in verrucosum. Then this Tinea cruris, which is also termed as jock itch or dhobi itch, It is there a groin infection done by whom? Epidermophyton, floccosum, and rubra.